Let's look at another example on the following page. Vitamin D deficiency contributes directly to the acute respiratory distress syndrome. Also another article showing that vitamin D supplementation provides clinical benefit in patients with COVID-19. Also very well known by now is the fact that patients with severe ARDS, acute respiratory distress syndrome, or those requiring ICU or intensive care unit treatment are frequently very severely deficient in vitamin D. Moving on now, let's go to component number 4 of these external barriers, which are the antimicrobial peptides. These antimicrobial peptides promote lysis of viruses, bacteria, fungi, and cancer cells. They are either pro or anti-inflammatory, but mostly we can consider them to be immunomodulatory. Here from 2017, we see the antimicrobial peptides, human beta-defensin and cathelicidin, or LL37, are key factors in innate and adaptive immune responses of the respiratory tract and play an important role in many respiratory diseases. So in human physiology, the two AMPs, or antimicrobial peptides, that you're going to hear most commonly mentioned are beta-defensin and cathelicidin or cathelicidin. Again, these rapidly inactivate many infectious agents. Most antimicrobial peptides act by disrupting the integrity of microbial membranes. The human cathelicidin peptide LL37 is chemotactic for neutrophils, monocytes, mast cells, and T cells. It induces degranulation of mast cells, alters transcriptional responses in macrophages, stimulates wound vascularization, and re-epithelialization of healing skin. That was from Journal of Leukocyte Biology 2003. Beta-defensins are small, cysteine-rich, cationic peptides that contribute to various processes related to both arms of host defense, the innate and adaptive immune systems. That's kind of an old way of looking at the immune system, I might add. All beta-defensins are potent antimicrobials with activity targeting a broad range of pathogens. Some human beta-defensins are also capable of binding and activating specific chemokine receptors. And again, what I want you to remember here is that antimicrobial peptide production is famously dependent on vitamin D. Component number 5 that I'm going to talk about is lysozyme. I'm sure most of you remember hearing about this in grade school or certainly in undergraduate biology. This is an antimicrobial enzyme specifically effective against many gram-positive bacteria. This is excreted in some fluids, most famously in tears, but also on the surface of the skin. Lysozyme levels are reduced